20 children worldwide have ADHD, and now during this COVID-19 pandemic, even more parents are looking to have their children and themselves diagnosed. Well, this is ADHD Awareness Month, and joining me is clinical child psychologist Dr. Janine Hubbard. Thanks for coming in. Good to see you again.
Oh, thanks so much for having me, as always.
So chances are we've all heard of ADHD, but what is it exactly?
Well, it is actually a neurodevelopmental disorder. It's one of the most common ones out there. As you sort of said, it affects about 4 to 5% of the population, both children and adults. Once upon a time, we thought kids outgrew this once they became adults, and we now widely know that it may look different in adults, but it certainly persists, and we know that it runs in families. One of the things that we know is no two individuals with ADHD look alike, which is often a confusing presentation, partly because there are 3 different variations of it. We have the hyperactive impulsive type. That's where you think of your traditional Bart Simpson. That's the climbing up on the desk. That's the poking the kid beside you. That's the blurting things out without thinking of the consequences. And we have predominantly inattentive. That's the daydreaming. That's the, you went upstairs to go and get a sweater, and 20 minutes later you're busy rifling through materials in your bedroom. That's the inattentive type. And then the third type is combined, so it has features of both.
Does it usually affect boys, or is that also a myth?
Really, what we know is that it affects males and females differently, and that historically females have been vastly underdiagnosed and unrecognized, especially if they tend to be the more inattentive type. So although the stats at the moment are a higher ratio of males to females, we actually suspect it's probably closer to even. It just looks different.
Okay, so I know that we've only got about a minute or so left, so I want to get in a few more things. So I've heard that because, we're in the middle of this pandemic, people, I guess, have been home more, they've been stressed about various things, and now people are being quite affected, of course, by this pandemic. So how are people with ADHD being affected?
Well, it's been really interesting. We've actually had a lot more people come forward looking for diagnosis, because the working from home or schooling from home has either pulled to people's strengths. They've discovered that, hey, if I can get up and move around, if I can hyperfocus, if I can work at slightly different hours of the day, I'm so much more productive, and I'm not being distracted by my coworkers. I wonder what's going on. And then the flip side are the people who, the lack of structure, the lack of routine, the lack of that regular accountability and check-ins with colleagues is affecting them, and they're finding that they're really struggling. So both extremes are happening. Same thing with kids and their school learning. So we actually are seeing people saying, COVID has actually really opened my eyes, or I'm seeing how much more my child really does struggle to learn. But hey, with virtual learning, they're able to get up and move around. They can fidget, they can move. So it's looking at the fact that we want to make sure people are being accurately labeled, diagnosed, and treated as appropriate.
Okay, so we are, I think, pretty much out of time now. So if people are looking for more information about ADHD, where can they turn? Well,
you can always check the APNL website. We have some lovely information, and there are 2 national conferences that are coming up this month, and for the first time ever, they're offering their conferences virtually, so those of us in Newfoundland can attend. CADAC is a group that mostly caters to parents and the general public, and CADRA mostly is geared towards healthcare professionals. Both of them are Canadian, and I'm really looking forward to learning some new information in them in the upcoming weeks.
Okay, Dr. Janine Hubbard, we need to have you in more often, but thank you so much for coming in tonight.
Thanks, Tony.